to lead that one.
Data must fall, not iPad.
Especially when it's got the numbers.
Sibu, why don't you just push this a little bit backwards?
Oh. I hope I won't interrupt with the second. Huh?
You're one of these Q&A sessions.
Oh, yeah.
Can you remember?
Thank you, President.
Thanks. 1 second, I'll open. Thank you very much.
That's how you have to sit.
No, I don't have to sit there. Don't worry. I'll speak loud enough. Don't worry. You can stay, Minister. Stay.
You want to
No.
get your voice. You want to get your voice. Please.
All right, just quickly, thank you very much, Minister, for joining us once again. We really do appreciate it. Obviously this COVID-19 is a big issue that we have to deal with as a country, and we're dealing with it across the world. And of course here in the Western Cape, we really appreciate this, your second visit to us. And obviously just your update on what you've seen, but for us, also in preparation, because we also are happy that the President is also going to come in the next while to come and visit us as well, and we will welcome that too. And it was a great opportunity for us to showcase on what we are delivering. So I really want to welcome you here, and I'm not going to waste any more time. I'm going to hand straight over to you, sir.
Well, thank you very much, Premier. My colleague, Mbobo, Director General, the Head of Department, and other senior officials, members of the media. Good afternoon to you. I hope you can hear me. Good. Good. It's nice to see journalists wearing masks. This is real progress. Thank you very much for that. If you can it be heard? Yeah, okay. Now, the first issue is basically to say thank you to the Premier for being here and for all the words of welcome. And thank you for being part of this meeting. Although we've come to the province, the Premier was generous with his time to be coming to see us and to be part of this discussion, because as he has said, we are all in this together. and therefore it becomes a very important issue that we should be able to discuss together and share on the various issues of concern, and also the updates in terms of what is happening at this point. I think to start off with, we came here because of various concerns that we have. Amongst the concerns has been the rapid increase in the numbers of people who are positive in the province. In this case, we have seen that almost 50% of the cases, positive cases, are in the Western Cape. That's a matter of concern to all of us, because it does mean to us that you have a situation where the outbreak has really moved faster than we might have anticipated. And that is the reason why we thought it was important to come and just share on the concerns, as well as look at what needs to be done to deal with this. Having said so, we also were concerned about the fact that we've lost a second health worker, which happened just last week, a few days ago. And we want to convey our condolences to the family, to the loved ones, as well as to the hospital, the staff members, or the colleagues who worked with her, as well as the Department of Health and the provincial government and the people in the province for this loss. We're aware it's a second health worker to be lost in the country, and also particularly in this province. So we really would like to convey our condolences, and may her soul rest in peace. We want also at the same time to convey our appreciation to the rest of the members of staff, particularly the health workers all over the country in South Africa, who are looking after all of those who are admitted in our hospitals. We do understand that their role is that of dedication, of commitment. We also do understand that they are there to serve. And we want to thank them most profusely and sincerely for the work that they've done. And we thank the health workers, but we also thank all those frontline workers. We've got the police, we've got the army, we've got a number of various other frontline workers who have to serve our people and might run a risk of getting themselves exposed to the infection. We thank them, we do appreciate the work they do, and we want it, even if we don't say so all the time, but we appreciate their work all the time. And it's a very important thing for us to say, we know there are professionals out there, we know that there are various categories of health workers, all of them are appreciated in the same way because of the very immense role they have to play in the fight against COVID-19. Between us, as amongst the issues that we are to discuss here, has been the need for us to prioritize our attention to the health workers. In particular, to make sure that they are well trained so that they understand what it means to be fighting COVID-19 and fighting infection. It is the special expertise of health workers to be fighting infection. So the issue of infection prevention and control is a matter that has to be a second nature for all our health workers. So we will emphasize that, and we've had this discussion here, not only in the Western Cape, but all over the country. Secondly, the issue of ensuring that they are well protected, the provision of the personal protective equipment, PPEs, will make sure that it is made available at the right level based on the exposure of the individual and the protocol that we have issued. We have therefore a commitment to source as much of that PPE so that we always have enough on stock, so no one must be forced to go and look after patients without being properly taken care of. That is another commitment that we have to make. We've even said, and I was briefing now the Premier and the MEC, that we have formed an Occupational Health and Safety Committee, which is involving both the public and private sector, as well as the government officials and the labor, to be working together. And amongst the issues that they must deal with is the issue of the protective gear and making sure that the occupational safety, occupational health and safety issues are taken into account. And therefore, we would like to focus on that issue. We've also discussed, and this is the matter that the MEC has also been very strongly, feels very strongly about, that when it comes to testing when necessary, that we will make sure that the health workers are prioritized, so that for their own protection and the protection of the staff, we are able to make sure that we take people into the front line and we know their status, and if necessary, they must be given that necessary attention. We also urge all of them to be able to go out there, health workers, to make sure that they get to be given the flu vaccines. This is an important issue as well, because the flu season is coming. We actually want to make sure that our soldiers in the forefront are both well trained, well protected, and ready to be able to face the outbreak that we are fighting, because they are in the forefront. So I want to leave that point as well, and therefore say, at this point, this is one of the issues that we had to discuss amongst ourselves as the leadership in government. Our approach has been that the outbreak in the Western Cape is an outbreak in South Africa, and therefore it requires all of us to work together as one government to solve the problem. We have to be guided by the professional and scientific, clinical, and other kind of professional guidelines or guidances that is available to us. So in that regard, I want to thank the Premier and the MEC for providing all the experts from the Western Cape to come and give us the briefing. I have received a briefing from about 7 specialists and experts in the province, 4 of whom were the professors and others are doctors who are the leaders in the various aspects that they were actually briefing us about. And I must say that I have been quite satisfied with the level of the presentation, the understanding of what the issues are, the analysis that goes into this, as well as the plans that they're putting into place to deal with this issue. If I can just say, the picture that has been painted by the epidemiologists is a picture that at all levels, from our National Institutes for Disease Control, for communicable diseases, NICD, they've given me a thorough analysis of the problems, the epidemiology of the disease, the variations that we are seeing. They have been able to indicate that, for example, in the Western Cape, we have a higher positivity rate, which when you compare to the rest of the provinces, it is clear that we are now dealing with a much higher level of infection here. They have also looked at a number of issues in relation to the spread of the infection. It is clear that the way the infection spread in terms of its demographics, age ranges is the same from with the rest of the country. It's also clear that both the gender as well as the other associated factors are similar to the rest of the country, particularly when it comes to the pattern of infection. It's a large number of people from the age of 20 to about 60. But when it comes to the morbidity, to the mortality, the increases in the Western Cape is a pattern which is the same with the rest of the country, associated with increase with age and associated with comorbidity. They've been able to break down to me that amongst those who have passed, 90% of them are associated, 93% are associated with at least one comorbidity. They've also indicated that maybe 65% of them have got 2 comorbidities That means, therefore, the pattern is not different to the rest of the country. So what we are now seeing is that the pattern here is something that the internal transmission has happened in the Western Cape probably a bit earlier and faster than we had all anticipated. And that means we have to now focus on a number of things, what needs to be done to deal with this kind of situation. I was therefore pleased when they took me through the number of plans that are in place. So, for example, the area that I want to deal with quickly and put out of the way, because it's got less controversies, is the area of case management. Here you had the top clinicians, the professors who were explaining to me how the approach is. I was absolutely satisfied with the approach in terms of case management, from the admission of the patients right up to the point of taking them to ventilators, taking them to ICUs, and so on. They have been able to indicate as well that insofar as the numbers of people who have to go through ventilators, they're seeing a similar pattern with what's happening in the rest of the world, that once people are at that level of ICU, that's where we tend to be associated with a higher level of mortality. And therefore, it becomes important for us to be able to deal with the management of all the other patients. However, the large number of patients who come in here are either asymptomatic or very mild. And that means over 90% of the patients will actually get in and out of institutions, and not for 2 or 3 areas that I want to highlight, where we had quite a lot of discussion about, which we realized there are certain constraints that we must manage and deal with together. The first of those is finding the cases. Clearly, we need to make sure that we are able to test our community, and then make sure that we find those who are positive. In the case of the Western Cape, from their report and from the report I got from NICDO and from the Ministerial Advisory Committee, it's been very clear as well that the numbers of patients who are testing positive is so high that in the past few days, it's between 24 and 30% of the specimens in the country come from the Western Cape. But when it comes to positivity rate, it accounts for about 70%, which basically means that they've been testing people where the rate is showing to be very high. And this, when the analysis was done, and again I was quite pleased to see that the analysis has gone further to the level of being able to identify why that is the case. We have a number of areas of cluster outbreaks. Cluster outbreaks is a situation where people who are sharing a common experience or a common geographic location infect one another, and therefore at one time you find a large number of people positive at the same time. And once you've got that confirmed, you realize that that area that brought them together is not necessarily their own area of daily daily residence. They then move out to various other places where they spread the infection in areas that have got nothing to do with the area where they are working. But then you start getting the spread. That is what's been going on in the Western Cape, and there have been a number of areas where they've had to close down factories, close down shopping centers to reduce the spread. Now, as a result of all of that, we have actually noticed that the numbers of tests that have come from the Western Cape have increased, but so has been the situation in the rest of the country. And so this has now created a situation where we can confirm that there's been a large number of new tests that have been done, and the number has gone to between 10 and 12 to 13,000 in a day, which is something that is a huge improvement from the position at which we started. However, there is a real shortage of test kits and reagents from all over the world. And therefore, this is putting a bit of a constraint now on our ability to test as much as we might all be wanting to do so. And this is an issue that we are busy discussing and trying to look for solutions, because the various suppliers are constrained, seeing that the whole world is seeking exactly the same reagents and same kits. So this is an issue that we are going to discuss amongst ourselves to look at how we're going to manage this issue, particularly from the point of view of looking at how to focus and target in areas where we will test and get the highest yield that is possible. And so, in relation to, therefore, the issue of the tests, I have actually called around to look at the National Health Laboratory Service, the NICD, and the various private laboratories. They are all suffering under the same constraints of the restrictions in the supplies of the test kits. We are going to be working together. I have also indicated that in the past, when there have been backlogs, the public sector and the private sector laboratories would actually collaborate and therefore help each other to deal with the backlogs. So right now we do have backlogs on all of them across both the public and private, but we're also going to be coordinating internally to make sure that wherever there's capacity, we share that capacity. In other words, where there's space in the private sector, we will actually be getting the private sector to do public sector tests, and where there's a problem for the private sector, we'll do the same. Obviously, the one issue that I want us to be able to discuss with private sector, I don't like their price. I think it's expensive, and I'd like us to reduce that, so we'll discuss that at the right level. I'm just putting it up front because when we discuss this issue, all the provincial governments need to know that we will have a common approach to the management of the cost of the tests. Having said so, I still think that there's been a lot that has been done in terms of the tests, and if you look around the whole country, it is very clear that there's been a lot of good work being done. Testing has been done all over, as well as the number of communities that have been screened is very high, and that is the strategy that we wanted to take forward, which is to say we go out to the public, we actually search for the small bushfires before they become a big flame, and that's what we want to deal with. So the area, therefore, of testing is a matter that we're managing. You might be aware, I saw you published already, the Premier had written to the President about the matter. Of course, we've been discussing the issue. We discussed it with the Premier, we've discussed with the laboratories, we've discussed it with the MECs. It's an issue that we're all handling on a day-to-day basis. Then, so the area of testing is an issue that we think that we have made a lot of advances. Therefore, we must now resolve the problems of the supply of the reagents and the test kits. The other issue that we have spent a bit more time on is the area of what we call containment. Now, this consists of a number of aspects. The first area of those is that anyone who's found to be positive has to be isolated and must be taken for treatment, and in this case, that is going on. However, we also want to underline the fact that increasingly we're finding people who might be positive, but nevertheless are not so sick or not even symptomatic. Now, we are going to be ensuring that those get admitted into the hospitals. Hence, the need for us to increase the field hospital beds, where people can go there. They don't need treatment as such, but they need to be there because whilst they become asymptomatic, but at the same time they are infecting other people. So up until the time is passed that they are discharged, it is not safe to send them home even if they are well. So I think that needs to be understood, because people will be kept in the hospital not because they're being treated. Somebody might turn around and say, but they're not doing anything to me. Well, we're not doing anything to you because we're no longer needing to give you any medication. But what we're doing is to make sure that we keep you there until you are past the point when the infection will go to the other person. So that's part we now have discussed that needs to be strengthened in the province to make sure that anyone who gets to be positive shouldn't go back to the community and become infective even if they're asymptomatic. A large number, as I've said, are asymptomatic, so it becomes very tricky how to manage that situation. The second aspect that we have discussed relates to the fact that we have to strengthen the quarantine. Now, all those who are contacts of the people who have tested positive have to be taken for quarantine. And I think we need to understand how this thing works. Right now, when you've got a raging outbreak, such as what we're seeing here, the crux of the matter is what do you do to break the cycle? And to break the cycle, you have to make sure whoever is either positive and has got symptoms or just positive and infective must be put into isolation bed. The ones who are associated must be kept in for, must be taken for quarantine. That means that the two possibilities that there were to spread the infection is limited. Then the people who are doing community screening will go out and see if anyone else has still got the infection or is exposed. It's important to take the people out of the community for a period and then take them back once that period of risk of infection has been reduced. That is what needs to be done. And so we've discussed this issue. The province is working very well, excuse me, is working very well to make sure that they find additional places for quarantine, and we're going to insist on that. But I must make a point at this stage that the province has worked on a plan which is very much aligned with what's going on at a national level, of looking at various levels of alertness in terms of the level at which the level of spread of the infection and the readiness of the department and the need to manage the community activities, so social activities in the particular area. It is important for us to indicate that Western Cape, but particularly Cape Town, is one area that we could classify as a hot spot. That means that there's a higher rate of infection. If I look at it, I've got about 8 of our metros that have got that problem. So it will be Cape Town, it will be Johannesburg, it will be Tshwane, it will be Ekurhuleni, it will be Mangaung, it would be Nelson Mandela Bay, it will be Buffalo City, East London, it will be eThekwini, and then Mpumalanga somewhere in Mpumalanga in KwaZulu-Natal. These areas are areas where we're seeing a very high rate of transmission. That means that when we move forward, there are areas where they've not had districts. Of the 52 districts, there are many that have either had very few people who are positive or none. Now, when we now ease the lockdown, there are others that are going to move faster towards normal activities, but there are others that are going to remain behind. So we should expect that in areas such as this one and the other metros, that there should still be lots of restrictions that could be considered, because we now need to focus on area by area. And I was quite impressed as well, because I've asked for the MEC to show me the breakdown. When you go into that level, you go to a city and you go ward by ward, block by block, to look at where the real problems are. You must therefore create a containment strategy based on public health policy approaches into that area. So that's what's going to have to happen in Cape Town. So when there's going to be need for restrictions, we want our people to understand that there's going to be need for restrictions in certain areas. We haven't made any determination. We're just simply saying that the approach going forward is going to require that there's a differentiated approach to the relaxation of activities and return to normality. It can't be the same. So where the highest rate of transmission is going to require that there should be even stricter restrictions. What those are will be determined at the right time, but at the moment I'm just indicating the approach, which we all agree with. In addition, we've also been agreeing that we're going to work together to support the province, in particular we're going to be looking at what additional support the province needs. So I've already promised that we'll look at the NICD to bring additional experts and epidemiologists and other analysts to come and reinforce the team. The team is doing very well. But when you've got a situation like this and you are really going to more intensive interventions, that is going to be something that's going to be done. With the delineation of the area into various blocks, we're also going to be reinforcing the team. We're going to be bringing in additional personnel. The Cuban specialists will also be deployed. And in addition, we've also asked that the province must look at additional medical practitioners as well as nursing practitioners that they might need to bring into the system, so that you can actually have adequate response, breaking the area down into area by area. It's an area of weakness in South Africa. The area of community health is a much weaker area for us, and therefore we need to strengthen that. That's why we've been focusing on the issue of strengthening primary health care, as well as ensuring that we move towards national health insurance. So that is the area that we're focusing on. We've also then agreed that we are going to be looking at further collaboration with the private sector. So, for example, when it comes to the issue of working with the private hospitals, private family practitioners, and private specialists, we are discussing the issue at a national level so that we make sure that the tariffs, the conditions of our relationship is strengthened, but we will actually make sure that we work together in that particular area. Another issue that did arise relates to the fact that some concerns have arisen from the Eastern Cape because of the very large movement of people between the two. I was very pleased to see that the Premier of Eastern Cape and the Premier of Western Cape have already been in discussion to deal with this issue, particularly because there are instances where, as people move across, there's a concern about the rising levels of infection that could be moving between provinces, and that I'm happy that they're handling that matter at that level. So I would say that largely those are the kind of issues that we have discussed with the province. And we are also making preparation for the visit by President Ramaphosa, which is confirmed for the 15th. And President Ramaphosa has been coming to give us all the support, moving around to say what is it that we will need, what is it that we require. And he also wants to be there personally to inform himself of the level of readiness. Now that President has been able to visit KwaZulu-Natal, visited Gauteng, he has indicated to us that he would very much like to be visiting this province, and we are quite excited about that. There will be a few other provinces that he's going to visit after that. So we will be able to then prepare for that together with the provincial government. And again, I want to thank the Premier for really making sure that he's hands-on and is always there as we try and make these kinds of preparation. So the one issue, therefore, that we're going to be taking from here, I've taken all these presentations and the slides, and of course I know that the DG is going to look at me if I didn't mention this, and that is the first problem was, well, we need more money now, more resources. Now, we've already expanded our budget, and we've just said, yes, we do understand that's the case, and therefore we will be taking the issues together in terms of looking at what additional requirements that the Department of Health is going to need to be able to move forward at this point. So with that, we believe quite strongly that we need additional resources on the department to reinforce not only the health response but also the community response. I've also been taken through that the district level, the provincial government, and make sure that there are coordination structures that will help us to deal with the issue of social advocacy and behavioral change. At this point, colleague, let me also just indicate to you that despite the constraints that we've spoken about, there has already been 324,079 tests that have been conducted. This is quite an increase, and of these 16,327 were reported yesterday. This is despite the fact that I said that we're already beginning to experience some backlog. So there's a huge amount of testing that has happened at this level. Of the new cases at this point, the new tests that have been confirmed are 525 tests, and that makes a total of 9,420 people who are tested positive. And in that regard, Eastern Cape has got 1,078 is the latest total. The Free State is 134. Gauteng is 1,910. KwaZulu-Natal is 1,308. Limpopo is 51. Mpumalanga is 61. Northwest is 41. Northern Cape is 28. Western Cape is 4,809. And all of them have been properly allocated, so we no longer have what we call unallocated. The numbers are increasing. We are concerned about it, but as we have indicated, there is a strong intervention to try and deal with it. And we have said as well that Western Cape, our interventions in the Western Cape are going to help us to inform a similar intervention that's going to be needed in different parts of the country. As we have seen how the other provinces where there have been interventions, it has been helpful to help us to see what works, and therefore we learn as we move along. Regrettably, we have to report, unfortunately, that we have more people that have lost their lives. So we're reporting now 7 new deaths, which have occurred in the it's 8 new deaths, 7 from the Western Cape, which include the nurse that we spoke about, and then 1 from KwaZulu-Natal. And therefore, as we have said, we do wish to convey our condolences to the relatives and families, and also we also want to also pay tribute to all the staff that have been looking after this particular patient. With that, I would like to say once more, thank you to Premier Winde and to the MEC and to the government of the Western Cape for the work that they are doing and the work that they've done today in preparation for the visit by President Cyril Ramaphosa next week. From where I sit, I am very convinced that with the focus, with the enthusiasm, with the dedication, we'll be able to turn around this situation. I just want everyone to know that when you get this problem of COVID-19, South Africa as a government will be united in fighting it. South Africa as people and their government will be together as we fight it. And therefore we do wish to thank our people for cooperating with all our programs. We know that sometimes there are constraints, sometimes there's a lot of inconvenience, sometimes there's anger, sometimes there's pressure. All of that we do understand. We're going to be meeting as National Health Council to look at how we can support the various workplaces as the different streams of our industries and economic activities return to normality. So we are going to be working together to try and fight this pandemic, whilst at the same time we have to balance with some of the requirements to ensure food security, income protection, and an economic activity that's going to be able to rebuild our economy back to what it should be. With that, I want to say thank you very much. I'd like to leave this now if MEC has got something else to add. Thank you.
Okay. No, thank you, Minister. I think whilst you are here, let's take questions. We're going to take 5 at a time. Probably that 5 maybe might be the last, but it depends. Whilst you are still sitting there, I think it's gonna be easier if you could take all 5. So you just indicate from which media, and then you can see whether, because the other questions might need to response from the Premier or from the Minister, and then from the department we'll work it ourselves. Ma'am?
April Bobia, SABC. Minister, I heard you explaining about the movement here in the Western Cape and explaining why it is slightly high, why it is higher here. I still don't quite understand what is happening differently here in the Western Cape, causing our numbers to be as high as what they are, because I don't know what is being done differently here compared to other provinces. And then you did say that conditions around the lockdown will be based on, for instance, the metros where it's higher, so there will be a staggered approach. But are there any talks in the pipeline about the Western Cape being pushed back up to level 5, just considering our numbers at this point?
Thank you. Next. Aisha?
Minister, Aisha Ismail from ENCA. We've been getting reports from KwaZulu-Natal of people who have tested positive in a certain area. And this was more than 14 days ago, and they've returned to hospital to be retested to see if they've now recovered. And they were told that they will not be retested. 2 of the people then went to a private hospital, and both of them tested, they still tested positive. The one even tested positive after 28 days.
Shawna Fisher from Eyewitness News. I would like to know just the fact that we've seen classes of infections that have been traced back to supermarkets and factories. Have you seen similar trends elsewhere in the country, for example, like in Gauteng? If not, given the fact that the lockdown compliance is fairly even, why do you believe this is? And secondly, Minister Mkhize asked that this question be directed to you, Minister. Is cell phone contact tracking already being used? If so, on how many occasions and how many contacts has the technology helped trace so far?
And 3. So.
Hi, Minister. Christian de Plessis from Netwerk 24. Minister, just for some clarity, when you refer to the field hospitals, will that be compulsory as well as the quarantine facilities for people who had come in contact with people who tested positive?
Right. Last one. On repeat. ENCA, okay. The last one.
Minister, just another question. You were talking about people who test positive, and you were saying that these people will not be allowed to go back into the community. They will be hospitalized at the field hospitals and then tested to see whether they are clean to return to their communities.
Clean.
Clear. They are clear to go back to their communities. How soon do we expect this to happen?
Okay, all right, thank you. Minister, you will indicate which ones that we have to ask.
Which one do you want to take? Okay. Let's, you see, the outbreak is very early. So there are many things we're going to learn. And there are many things which we will postulate and then prove later to be correct or disprove. So in this case, what we are seeing is that unusual to what has happened in other provinces, we've got a predominance of cluster outbreaks. Cluster outbreaks are happening in commercial settings, in factories and retail shops. But we had a similar thing in the Free State. In the Free State, it involved a church. It was a church conference, and it was another cluster where you, from one experience, you then end up with a kind of an explosion that went all out to various places. The pattern is more or less the same. So it can happen anywhere. All that we need is to basically say, when you spot, you need to then act on it. And one of the actions is to make sure that you test, you want to find one person, you test the others, then you need to close the place down, decontaminate, and then treat those, and then reopen after a while. So that's what we're doing here. I wouldn't say there's anything that's different. The only thing that I can say is different from what we're seeing in the Western Cape, that the infection is spreading fast, and one of the drivers is this one of the cluster outbreaks. But they have been acted upon, and now it means we must be on the vigilance to be able to pick up any new ones that are coming through. Some people have raised concerns around the farming community, particularly as it involves the the seasonal harvesters. Again, the two provinces are going to be looking at that so that they can see how to manage. It will mean that we involve the farming community, the processing, because in this case it was where it has been spotted is in the agri-processing plants, where it's almost like a factory where they're doing processing. So that we're going to give attention to that. When we say it's a staggered approach, we're basically giving it in principle. We have not discussed anyone who goes to which level, but we are saying people must not be surprised. There's not going to be one size fit all here. We're going to have a situation where, based on the challenges and the level of transmission and the risk to the community, certain restrictions will be imposed that might be equal to whatever level of a restriction. So that's what we're talking about, and I think that people need to always be aware that we're going to work on all of this, but we will ensure that those restrictions are implemented if that's what's going to be helpful to save the lives of our people. The other question from ENCA it's about people who are positive and are returning to hospital. If you give us the names, we can check for you what happened. Right now, I don't have any specific information. I am aware of a few rumors and stories that's been going around, and those where there were specifics we checked, we didn't find a story like that. So I would not be sure what you're talking about, but let's deal with the issue in principle. On an average, it takes 2 to 14 days to incubate the infection after exposure. But the experts believe the infection generally sets in within 5 to 6 days. The bulk of the people will have less symptoms or no symptoms, and the others those who have got no symptoms and those who have symptoms do shed the virus during that period. And when they do, the body works on the virus and sheds it until the virus is completely reduced from the body. The average is that it takes up to about 14 days for that to happen. So what we have agreed, and this is the international norm, is that generally when someone has got the symptoms and diagnosed positive, 14 days later, they should have, by and large, shed the virus off. And so many of them will be found to be negative at that point. But it is possible that there will be those who will not be negative at that point. They will still remain positive. But the researchers have confirmed to us that even if people are positive at that point, the level of infectivity is so negligible that they are unlikely to transmit the virus to the next people. And so we feel comfortable that if anybody was given 14 days at home and then they still had a persistence of the test, they are not as dangerous or as infectious as they would have been were they for the earlier part of their admission to the hospital. So I would say, because of that, we do not feel that it's necessary to repeat the test once you've finished 14 days, because the test can be positive or negative, but we think that the clinical impact of that, if the individual is well and the individual has got no symptom, then they shouldn't be really causing too much of exposure to other people. So that's the way of approaching it. And that is the basis of which would discharge anyone as being recovered. It takes us to the next question, although I think the question that's being asked is a bit different. The question is, if someone has been admitted and 2 days later they are positive but they are feeling healthy, they are happy to go home, but they can't self-isolate at home, they will still be at risk of causing infection to others for another so many days until the end of 14 days. So we will insist that those people, if you can't isolate at home, then you must go and isolate in the hospital. That's why you go to the field hospital. It is compulsory to be self-isolated. The only question is the doctor can evaluate whether your living conditions allow you to be isolated at home, or it actually means they must recommend that you stay longer in the hospital. Isolation is recommended, and we would like people to cooperate with it. But if you don't cooperate, it then gets enforced. So that you must understand. The only difference is whether the clinicians are satisfied that isolation can successfully take place at home without the risk of infecting others, or it's better to actually get someone to be treated in the hospital. Then supermarket. No, that's going to be answered by MEC. Supermarket.
And trends,
Then,
other
okay.
province.
Yeah, and then cell phone. Well, we haven't really started using much of that tracking aspect. We're using it for other things, just to record the presence of where the people that were screening are, where we're finding people to be referred. We're using it at that. We haven't really gone that far to be able to start tracing, to use all the tracking. We'd love to use it, but we're not completely at that level yet, but we're really working towards that as well. The issue of supermarkets, MEC will be able to give us that answer. Just to say, for the other provinces, we haven't really seen it, but she can talk about it in this area. I'm going to move so you can come in. Thank you.
That should have been the Premier who answered. But I think the Minister has already responded to such that in the Western Cape, we have seen as many clusters compared to the other provinces. But in our response, it's not only about following the case in regard to the tracing the contacts, but also it's about coming up with the measures like the guidelines that the Health Department together with the Department of Economy and also other departments in the province to come up with the guidelines, and also in terms of sector per sector. So we've already been there. We have published those guidelines for each different sector so that we can know that if you are working in an environment like a post office, what is your responsibility as an employer and also as an employee? Supermarket, what is the responsibility of a shop owner and also of the shop user, what we call supermarket etiquette. So we have been there around that. I think what is crucial is about, whilst we might have about 500 of the positive essential workers, because noting these are essential workers, most of them, whilst we have those, we have to follow them back home, and most of them, they might not necessarily be working where they are residing. So that's why you'll find the issue that the Minister was talking about, the mention about like in the metro, you've got 8 sub-districts. So there might be the workplace might be here in town, which is the Western District, but the person stays maybe in Hout Bay, which is the Southern District. So meaning you will have to follow some of the 5 of the cases might be in the Hout Bay, but the other workers, they might be in Khayelitsha, or the other workers might be in the Eastern. So that's why you find in all of the 8 metro districts, we do have a high level of local transmission. But as we have indicated, we have worked it across. Same applies I know the Premier is going to Witzenberg, one of the high areas with a high local transmission in the rural district, where already we have come up and developed a plan that can speak to what the Minister has indicated about hotspots and using the whole of government strategy. I think the Premier probably should speak around that. It talks also about what the Minister has indicated in the metro, because he indicated that all metros, they've got a high level of the local transmission. The question is, what are the plans for the metro, zooming specifics in those hotspot areas, and also to have some of the implementation of the strict restrictions, but it cannot be only health alone. It should also be other departments, the law enforcement officers, and all of those. I think the Premier probably should just talk about the Witzenberg and the whole of the government in that space.
Thank you, Minister. So with regards to, last week we had the hotspot identified as Witzenberg, and we've got 8 hotspots here in the city. And so we developed those plans, which is a whole of government plan. How does traffic and SAPs and policing get involved in making sure that we get behavioral change, that we close down and lock down? Or, for example, how do we make sure that the economy is involved, and you meet with the businesses and make sure they've got the right protocols in place, specifically a place like Witzenberg? Have you got social distancing even within your factory or your processing and workspaces? How do we deal with businesses when people come to get when people come to town to come and do their shopping? Suggestions of how we can even get businesses to stagger paydays, so you don't actually all get your salary on a Friday. You can actually start staggering different parts of the town or the region, so people actually get their money at different times, so that you can actually start reducing congestion in town, because it's about getting the sort of congestion down, the social distancing in place. We go and meet with the community leaders.
The question?
Oh, okay. Is there another question? There's another one.
Minister, are you concerned the Correctional Services Department announced over the next 10 weeks they're going to put their parole system in place? And
Okay.
And if so, by how much or how little as compared with the annual averages?
Okay. Let me just deal with the first issue.
The deaths.
Yes, the deaths. All right. Let's start by saying that we have 9,420 new cases, new positive cases. That is 525 new positive cases in the last 24 hours. We've got 185 deaths, and we've got 3,983 recoveries. That is where the total deaths and recoveries as resolved cases who are likely to spread the infection are those who are not in these 2 categories. So we can just leave it at that. And then the average mortality rate is just under 2% in the country, and that is not that is in keeping with the but of course there are many countries that have much worse than that. So in our case we have that as our numbers, and that we think is within the norm, and we use it to entertain the figures. We sometimes take the figures and then use that norm and try and estimate how far away from the total number of possible focusing. So it's still within an acceptable range in terms of what we're talking about. Then the other question relates to the prisons. Look, I think what we need to do from the point of view of dealing with COVID-19, we need to adjust to the fact that it's a change of behavior that's going to be important. The change of behavior will mean that we need each one of us to know that proper hygiene, coughing and sneezing hygiene, hand sanitizers, using masks and keeping a distance. That is where the risk is reduced for the infection. Whether you've got more people who come from prison or not, if everyone focuses on that, that won't affect us. So what is important is for people to also move out, will have this infection if they're exposed. And so we mustn't start making too much of a label onto any part of the society because of the risk of exposure. I think it's important to say that all of us are at risk, all of us can take action, and all of us can save the nation from the infection. Thank you.
The restrictions.
What restriction?
Repeat your question.
It calls for the level 5 restrictions to be implemented again in the western parts of the Western
You wanted
Cape.
to know whether the other department will be involved.
No.
No, and there has been calls for hotspots, certain hotspots.
Oh, that's for the premium. No. When you ask that question, I'm here from not the premium.
So, Minister, could I just ask a point of clarity on the Minister's response?
Okay. Because I'm looking at, because also the minister has to leave, so it's Mr. Williams, and then the premier respond to that, and then I think after that the premier, then you can just maybe close.
Ma'am, I was asking about South Africa's net death rate. My understanding is that
I see.
stats as to how many
No.
people die normally during a month.
Yes.
What is the current death rate in relation to the normal average?
Look, I don't have the figures, but I can tell you this. For the past 5 weeks, the death rate has kind of decreased. And the decrease has been mainly attributed to the reduction in unnatural causes. The motor vehicle accidents, the gunshot wounds, the gang violence, the stab wounds, all of which are linked to interpersonal violence. The interpersonal violence which are linked to the consumption of alcohol. I don't have the figures here, but we've actually got a demonstrable pattern that's showing us that we've actually have a large number of deaths that have actually been avoided in the past few weeks. So from that point of view, the past few weeks have actually reduced the numbers of deaths.
And
That also goes with the pressure in the casualties, in the theaters, in the orthopedic the departments, etc.
And in relation to normal comorbidities? In other words, if 100 people normally died of heart attacks or various things, what is that number now, if you take out the interpersonal violence?
Well, we'll have to get that analyzed. But at the moment, as we speak, all we can say is that those morbidities that are associated with COVID-19 have been largely associated with comorbidities of heart to cardiovascular diseases, pulmonary diseases, cancers, and diabetes, and those are largely the issues that are associated. We haven't got any other study that shows any other pattern at the moment. Thank you.
Thank you, Minister. Thank you very much. So that question on level 5, no, there's no discussion of going to level 5, although I have heard certain people calling for it. Obviously, it is a tool and a lever that you can use, but our discussion was, how do we have a look at those hotspots? And so what you're doing is focusing on the hotspots and management tools around the hotspots, because of course there's lots of, or many municipalities in our province. And in actual fact, the number of infections are reducing, and quite a few of them who've had a stagnant number for more than 14 days, so they're almost going down to naught again. So it really is not about going to level 5. It's about dealing with the hotspots where it is growing fast. And in actual fact, I think we've got to talk later about how do we actually enable more of the economy in some of those other places sooner.
In closing. You are closing.
And then I'm closing. All right, once again, thank you very much. Can I say, Minister, thank you very much for spending the amount of time you have with us. I must also use this opportunity to thank those health professionals who came and gave their reports. It is always good to know that you have this solid base of really good professionals. So Dr. Kluti, you, your team, and all those professionals that you pulled in, thank you very much, because it helps the minister also feel a bit more confident when you see these numbers and you need to come and see exactly what is happening. And as he said, you can see that from that aspect we've got a good team. Of course, it's about managing the hotspots, and that was a lot of the discussion. Understanding some of the risks and shortfalls, and we've addressed those, and there's some of those areas that we will take forward. So it's these kind of meetings that are really crucial. So once again, Minister, thank you. Really proud of them. We know that in recognizing them, and I want to just end off with saying as well, from my side.